Sorel Garamdi. Let's go ahead and start talking about the coronary artery circulation. In this video, I'm going to tell you everything you need to know about the coronary artery anatomy and how to make it easy to understand. This is how the heart is oriented in the body, but let me show you a different way of looking at the heart to make it easy to understand. I like to orient the heart like this. If we look at the heart like this and slice through it, we can see that the heart is quite symmetrical. There is the right atrium, right ventricle, and left ventricle. And what's the most important structure in the heart? That's really going to be the muscular left ventricle. This is the structure in the heart that squeezes 60 times a second, providing us with the blood pressure that we need in order to live our lives. So you can see how thick the muscle of the left ventricle is compared to the right ventricle. So the goal of the coronary circulation is to provide the most blood possible to that left ventricle. There are two basic planes of anatomy, or axes, of the heart. There are the atrioventricular plane. You can see the atrioventricular plane kind of runs in this direction, and there is the intraventricular plane, kind of running in this direction. You can see that these planes kind of take circular orbits around the heart. I can spin the heart in this direction, and you can see the atrioventricular plane. You can see how I'm cutting in between the atrium and the ventricles, coming around to the left side of the heart. And now I can spin the heart kind of in the intraventricular plane, going the other way. I can see this coming around to the apex of the heart, coming to the undersurface of the heart, and this portion here called the crux of the heart. So now that we understand the two planes around the heart, the atrioventricular plane and the intraventricular plane, understanding the coronary artery anatomy is actually quite simple. I'm going to go ahead and start with the left coronary artery. This is the aorta here, cut. I'm going to cut down a little bit more, coming up, and you can see this sinus of Valsalva here on the left. That's going to give rise to the left main coronary artery, and that's going to bifurcate into two arteries. Let's take this artery here coming to the left. You can see that this artery takes the plane between the left atrium and left ventricle. So this is going to be the left circumflex artery. So it actually courses around here as a thin vessel here in the atrioventricular plane and curves around to the undersurface of the heart. This prominent vessel here is actually the obtuse margin, the obtuse marginal artery, or the OM1. In most coronary circulations, the left circumflex is going to give rise to a thick OM1 to perfuse the lateral aspect of the left ventricle. It's not going to really perfuse the undersurface of the heart. So that is the left circumflex artery. Let's go back to the left main artery. And here is the prominent vessel coming here anteriorly and taking the plane between the two ventricles. This is the LAD, probably the most famous of the coronary arteries, sometimes known as a widowmaker. And you can see how it's coursing right down the middle here. And this perfuses the septum, the muscular septum of the heart, and a portion of the anterior aspect of the left ventricle. You can see here a prominent branch coming here laterally, and this is called the diagonal branch. This is going to be a D1 branch. And you can see that on the opposite side of the vessel, there are these other short branches, which are going to come out and then dive down, and these are going to perfuse the septum of the heart. So these are going to be the septal branches. You can see how the LAD curves around the intraventricular plane and becomes thinner and thinner as it comes around to the cardiac apex. So lastly, let's do the right coronary artery. This is the right sinus of Valsalva, and here's the ostium, or origin of the right coronary artery. This is the right ventricular outflow tract here, which I'm cutting out of the way. So you can see the right coronary artery is a prominent vessel which takes the plane of the right atrium and right ventricle between those two, the right atrioventricular groove. You can see it's somewhat analogous to the left circumflex in that sense. It gives off a prominent vessel here called the acute marginal branch. This supplies the right ventricle free wall. But the right coronary artery, you can see how thick it is curving around here. It's really responsible for perfusing the undersurface of the heart. You can see it curves around in the atrioventricular groove and comes here to the crux of the heart. Here it gives off two major vessels. it gives off here the PDA. This is actually a dual PDA, or posterior descending artery. And you can see this is perfusing the undersurface of the heart, the inferior intraventricular septum. There's an additional branch here, which is out laterally, and this is called the posterolateral branch. This is going to be perfusing the undersurface of the left ventricle, the inferior aspect of the left ventricle. Lastly, I just want to touch on dominance. Most hearts are right dominant, and what does that mean? That means that the right coronary artery is going to be the vessel responsible for supplying the undersurface of the heart with the PDA here and the PLA here. In about 20% of hearts, the left circumflex artery actually does that, and you can see how the right coronary artery and the left coronary artery are somewhat analogous in that they both take the atrioventricular plane. You can imagine that this vessel could curve around the back and supply these vessels if it wanted to. Of course, it only ends up doing that in about 20% of hearts. Alright, so there you have it. That's the coronary artery anatomy, made simple. Sir RMD, I'd like to shout out all my listeners in the US, UK, India, and Australia. If you like this video, make sure you click like below and subscribe for additional content. Leave a comment if there's anything you think I missed or anything else you'd like a better explanation of. Once again, Sir RMD, take care.